Hey, what's going on, guys? Just wanted to make another quick video here over a topic that I recently discussed, and this is going to be sepsis, but more specifically, what is the basic definition of sepsis? You're going to hear this thrown around a lot, and I think it was actually kind of difficult for me to find a very simple definition of just what is sepsis. And it's pretty easy to get lost in a lot of the literature, but I'm just going to make it very, very simple for you guys so that if you ever get asked when you're rounding as a resident or a medical student, or just somebody asks you what is sepsis, you're going to have a very clear, distinctive answer for them. So let's go ahead and get into it. So the first component of sepsis that we need to be aware of is SIRS right here. And SIRS stands for Systemic Inflammatory Response Syndrome. Okay, so when you hear SIRS positive or SIRS negative, this is what it is going to be referring to. So let's go ahead and figure out, so what are the different components of SIRS? They're related to the vital signs, specifically abnormal vital signs, okay? So let's go ahead and just fill out the different components of each one. So for temperature, all right, if it is greater than 38 Celsius or 100.4 degrees Fahrenheit, so a fever, or, and this is important, it could be it's less than 35 degrees Celsius or less than 95 degrees Fahrenheit. So that's for temperature. Now let's go ahead and move to respiratory rate. So if it's greater than 20, and also related to this, is if you have a PaCO2 less than 32. Now on to heart rate greater than 90 beats per minute. And then finally a white blood cell count that is greater than 12,000 or less than 4,000 or greater than 10% bands. So this right here is SIRS, and for something to be SIRS positive, you need greater than or equal to 2 of these criteria, okay? So if you want to label something as SIRS positive, you'd have to take a look at their vitals and say, okay, if they had a fever of 101 degrees Fahrenheit, and then they had a respiratory rate of 21, boom, SIRS positive. So greater than 2 of these criteria, 2 or greater, that's SIRS positive. So that's one component of sepsis. The other component of sepsis, so it's all that plus proven or suspected infection source. Okay? So really, when deciding is a patient septic, this is one of the guidelines you can follow. Now, there's a lot of debate, again, and you'll find different resources, but this is the one I found that really made it the most simple. All right, it's simply SIRS, 2 or more, plus proven or suspected infection source. So if you were looking at a patient and you noticed they met 2 or more of these SIRS criteria, you could maybe order blood cultures. You could see if there was some kind of infection on a line that was put on the patient, and then boom, you could figure out if there was a proven or suspected infection source. Maybe they had a pneumonia even, and then boom, you could say that this patient meets the criteria to be septic. Now, a little bonus is going to be over septic shock. So what's a very simple definition for just septic shock? So what this is, it's sepsis, so what we just covered, so 2 plus SIRS plus an infection source with hypotension, aka low blood pressure, that does not respond to fluids. So say if you have a patient who was really sick, they had a low blood pressure, say like 80/60, you gave them fluids, all right? So hypotension, gave fluids, but it did not, and I made a frowny face there, but with those fluids, it did not improve that hypotension. This could also include plus having organ dysfunction or poor perfusion. So again, just to wrap things up, and in the interest of brevity here, so again, sepsis and septic shock, basic definition. So for sepsis, it's going to be 2+ of the SIRS criteria, SIRS positive. So it's going to be, again, temperature, respiratory rate, heart rate, white blood cell count within these parameters. So if you meet 2+ of those and you have a proven or suspected infection source, you could say that this patient meets criteria for sepsis. And then a little bonus piece, septic shock. So the patient is septic, they're hypotensive, you gave them fluids, but that additional fluids did not improve their hypotension. All right, guys, so I hope that was helpful. See you next time.